Welcome, everyone. Hello. Thank you all for joining. Good morning or afternoon, wherever you're joining from. Welcome to our third and final installment of this webinar series, Supporting Decision Makers Using Opioid Settlement Funds. Today's webinar is titled Planning for Prevention and Measuring Impact. My name is Amanda Gao. I'm a Senior Program Assistant at Prevention Institute. Prevention Institute's a national nonprofit organization, and our work is really centered around bringing equity and prevention into policies and programs in the places where people live, learn, work, to really foster health, safety, and well-being. I'm joined by some of my colleagues here at PI, as well as partners at RTI International, who you'll be hearing from later on in today's webinar. Just a couple of housekeeping notes. We will be recording the webinar today, as well as sending the slides and the recording out to folks via email. So anyone who's registered will receive a copy of the recording and slides. We'll also be putting this recording onto our project webpage. So if you're interested in catching that, you can get that update later on as well. The project webpage, I'll drop that link into the chat. This also includes the webinar recordings for our first and second webinar. If you're interested in catching those, if you missed those or want to rewatch any portion of them, those are also available to you. This webinar series is supported by a cooperative agreement with the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. Just wanted to share that the contents are those of the authors, so us here at PI and RTI, and don't necessarily represent any official views or an endorsement from CDC or HHS. I also wanted to share a little bit of project background. If you joined either our first or second webinar, you may have heard a little bit about this already. This project is supported by CDC's Division of Overdose Prevention, and it's a joint effort between PI as well as our partner organizations, Big Cities Health Coalition, ChangeLab Solutions, RTI International, and SheRay and Associates. Through this work, we've been working to provide technical assistance and capacity building opportunities to decision makers to help them identify, select, and fund evidence-based strategies through the use of opioid settlement funds that can help prevent drug overdoses and reduce the harmful consequences of substance use. We also hope to build capacity and an understanding for approaches that span the continuum of substance misuse, and that'll be something that we share a little bit more on today. We understand that this work encompasses working across a lot of different stakeholders and bringing various perspectives together. So through this project, we've been striving to gather and share work that can be helpful to attorneys and legal professionals, state and local government folks, public health practitioners, as well as centering the experiences of folks with lived experience and community members, as we know that they're really important to bring to the table and keep there as well. Through this project, we hope to increase an understanding in jurisdictions about making decisions on the use of settlement funds that can leverage this relationship between strategies across a prevention continuum. We also hope to increase the use and existence of various tools and frameworks and materials that can support substance misuse prevention. And finally, hope to increase coordination across partners, sectors, and different jurisdictions in support of these efforts, as we understand that no one agency or entity can do this work alone. Just wanted to introduce the team here at PI. We have Sheila Savannah, Dana Fields-Johnson, Juan Gonzalez, Maddie Dillon, as well as myself. We'll be hearing from a few of these folks today. And with that, I'll pass it over to my colleagues, Sheila, to share a little bit more about Prevention Institute's perspective and how we think about prevention in the context of the opioid epidemic. Oh, looks like I think Sheila may have dropped off, but I'll pass it over to my colleague Dana, and she'll share a little bit more about our view.
So good afternoon, everyone. Thank you for joining us for our third and final in our series around understanding opportunities around opioid settlement funding. First thing we want to do today with you is really present what we think is an expanded understanding of what prevention is as it relates to the opioid epidemic and new lenses and expanded lenses for thinking about it. And we'd like to use the prevention continuum as well as a framework for decision making. And what my colleague Maddie will be sharing with you shortly, a set of guiding principles that can support decision makers in adopting primary prevention strategies in their response to opioid epidemic. On this slide, you see the prevention continuum, and across the continuum, all the ways we can bring a lens to thinking about prevention. Opioid settlement funds offer, again, unique opportunities to resource jurisdictions and their multi-sector partners in implementing an array of interventions in their work. And included in that is upstream prevention efforts. We'd like to share with you again this framework and highlight the important opportunity and role and lens for public health agencies in responding to the opioid epidemic. And to think about how you can guide collective action through a comprehensive approach and lens. The concepts of primary, secondary, and tertiary prevention have been mentioned throughout our webinar series. You've heard of examples from other colleagues and jurisdictions around the country for where they are resourcing various strategies across the prevention continuum. And so today we just want to unpack a little bit more each of those areas of the continuum, as well as think about examples. We also want you to use the lens of thinking about where your jurisdiction is putting opioid settlement resources or considering putting those resources, and think about whether you are seeing those apply comprehensively across the continuum. One way that we want you to think about the continuum is through asking what's being prevented. Next slide. In the primary prevention space, when we ask ourselves what's being prevented, and in the space of prevention altogether, we are thinking about reducing risk factors and increasing protective factors. That is our goal in public health. How do we reduce risk factors for opioid misuse? And how do we increase protective factors? Again, in the primary prevention space, strategies would focus on reducing risk at the community or societal level, preventing and limiting exposure and the drivers of misuse. So there, we're thinking about things like, how do we prevent social isolation? In our work in rural counties in Ohio a few years back, one of the things we heard over and over again from the communities there that we were working with was that the drivers of the epidemic in their communities really were connected to social isolation, not having access to resources they needed, and also things like generational poverty and a lack of access to economic and educational opportunities. So there, we're providing an opportunity to really think about strategies that lift up those things and really move to address those root causes. In the secondary prevention space, strategies and solutions really are thinking about escalating use and misuse. And in addition to that, what are we preventing? We are preventing that escalating use and misuse. We're preventing those risks associated with it. Here you might see strategies really start to come into play around harm reduction. And we've heard a lot throughout the series about harm reduction strategies and how jurisdictions are thinking about acknowledging, one, that there is already an issue in communities, people are using, and so we need to think about how do we reduce misuse and how do we support people to move towards treatment and recovery. There you might see things and resource strategies that are associated with improving access to treatment and clinical support. In the tertiary prevention space, what's being prevented? Well, here we're thinking about prevention of risk for overdose and those comorbidities associated with overdose deaths. Strategies here might include rapid response and street outreach teams and other harm reduction efforts that are connected to things like medication-assisted treatment and naloxone distribution. Strategies to repeat ER visits might also be a part of where you think about and how you're thinking about tertiary prevention. Next slide. Oh, I'm sorry, long-term recovery. Thank you, Amanda. I'm so sorry. Here we're thinking about preventing recurrence of substance misuse. Once people are moved to long-term recovery, how can we put in place strategies to think about how we support them in recovery and sustaining their recovery long-term? So the question here is, how do we prevent risk of recurrence and misuse? And a lot of that we feel like is very tied to what's needed in the primary prevention space, creating community and societal conditions that support people in their long-term recovery. While it's important to think about prevention in terms of what we're preventing, we also think that it's important to think about a longer-term vision and what is being created in community environments, right? And what is being created across the prevention continuum. So in that, across the same continuum, we can ask that question, what's being created? In the primary prevention strategies, we're centering around mitigating risk of exposure again by building protective factors within communities. And that could also be about establishing healthy relationships, supporting healthy norms that around not using or misusing substances and opioids. And these really center around healing and creating thriving community environments. In the secondary prevention space, what's being created? Here we're building protective factors once exposure or use is present again. And we're thinking about those opportunities and options to increase access and opportunity to engage in intervention and treatment supports. So that is secondary prevention. When we ask what's being created in the tertiary space, we're thinking about how do we put in place harm reduction measures that are really connected to the urgency of the epidemic and saving lives once use and misuse is already present. This includes strategies, again, around harm reduction, medical treatment, linkages to recovery, and then post-recovery supports as well. And then further along on the continuum, again, once we move people to long-term recovery, some of the strategies there that you might consider resources or might consider as a part of your comprehensive strategy are those around supporting people with lived experience, where we create community strategies that continually support disruption of the previous pattern of substance misuse. Similar to what's created at the primary prevention level, but additionally, this emphasizes the creation of successful opportunities that support thriving and healthy relationships. And when I think of this, I think of one of our Ohio partners, and it was a very rural county, but they really were looking at the economic impact and how they could support people in recovery through employment. And so they were working on efforts to educate employers on what to expect when they hired people who were in recovery, right? And really creating what they talked about as trauma-informed employers. Again, this whole space centers around those with lived and living experience and thinking of recovery as a measure of success. Next slide. So I'm going to pass off to my colleague, Maddie. And again, I just want to go back to the prevention continuum as a framework for you all to think about how you put in place strategies across the continuum, but how you also think about decision-making around opioid settlement funding. Maddie is going to present a set of principles that can also serve as a decision-making framework as we think about moving upstream.
Thanks so much, Dana. I really appreciate the overview of what prevention encompasses. And so I think, keeping in mind what we shared on this prevention continuum, especially in the framing for primary prevention, we'll be thinking about this framework for moving upstream a little bit. And so opioid settlement funds offer an opportunity to research jurisdictions and their multi-sector partners in implementing upstream prevention efforts in their work. And so this framework proposed here is intended to guide collective action in taking a comprehensive approach to a comprehensive public health approach and can be used by decision makers as they continue to address the opioid epidemic. And so we envision that this framework here can be used by decision makers so that they can leverage primary prevention strategies throughout opioid remediation strategies, including opioid treatment and long-term recovery interventions as well. So in the next few slides, I'll be sharing a little bit more about these guiding principles on the screen, and we'll share some examples of actions under each principle that decision makers can integrate into their work. So on the next slide, thank you. We have comprehensive investment across the prevention continuum. Opioid settlement funds provide a really valuable opportunity for decision makers to make strategic investments that address the full continuum of substance misuse or substance use. And so whether that individual has been exposed to substances, is actively navigating a use disorder, or has used in the past, this through balanced investments in primary, secondary, tertiary prevention, decision makers can address both the immediate and pressing community needs while also building out the social and organizational framework that's needed to prevent further opioid and substance-related harm from happening. And so an example of this principle in practice is to allocate funds toward addressing root drivers like socioeconomic inequality or unstable housing, as well as funding in secondary and tertiary strategies. We also have engaging in a multi-sector approach. I think many, if not all of us, are aware of how pervasive the negative impacts of the opioid settlement or of the opioid epidemic and opioid misuse is across society and across various sectors. And so transformative change will really require a multi-sector approach that brings together public health, healthcare, behavioral health, harm reduction, and first response sectors, as well as those in housing, social service agencies, local businesses, advocacy groups, and like elected officials. All these folks come and work together to design community-centered solutions. And so an example of this principle in practice is to really build coalitions across groups who are impacted by and are also working to prevent the opioid epidemic. And really be sure to include non-traditional partners, such as those in child welfare and folks at civic locations, like libraries, community centers, places of worship, and so on and so forth. On the next slide, we'll go into the next few principles. We have actively countering stigma. Addressing stigma is critical because marginalization of folks who use substances is harmful and it really puts them at risk of recurring substance use. It acts as a barrier to treatment and recovery. And so addressing it involves and encourages larger community conversations, just normalizing discussions and reducing isolation, and also addressing the root causes of substance misuse. And so an example of this principle in practice is to really involve, highlight, and resource folks who have lived with lived and or living experience to review and inform alternatives, and also can help to interrupt harmful language. It's important to also emphasize and address the community factors that are contributing to substance use disorder here. The next principle we have here on the screen is to embed health equity and racial justice into plans. So, to fully realize healthy, safe, and thriving communities, decision makers should embed health equity and racial justice principles into policies and programming for their opioid settlement funds. BIPOC communities are more likely to experience overdose and overdose deaths, to experience racism and stigma when accessing treatment and recovery services, and also face criminal justice involvement relating to drug use and experience community trauma that can increase the risk of substance use disorder. And so to address these harms, decision makers should look to leverage strengths that center community healing and affirm community power, and should also include culturally responsive approaches in their plans. They can also distribute decision-making power and resources toward communities that have been disproportionately affected by the opioid crisis. And so we'll go to the last two principles in our framework here. We have weave together multiple forms of evidence. And so, in this principle, it looks to maximize the impact of opioid settlement dollars. That really requires evidence-based decision-making that integrates research across multiple and diverse sources. And so practitioners should look to leverage the wealth of best available research that exists around prevention, harm reduction, and treatment solutions. And so an example of this principle in practice would be to design and implement solutions that measure the impact of settlement funds to include both contextual and experiential evidence that is culturally relevant and also community driven. The last principle that we'll be sharing today is to build sustainability and accountability into spending plans as well. This strategy notes the importance of building sustained long-term investments to continue the work and success beyond what's available in the opioid settlement funds, and can also be taking learnings from previous public health funding efforts, like those in the Tobacco Master Settlement Agreement. And so an example of this principle in practice would be to conduct strategic planning processes that not only determine what's the best short-term use of dollars, but can also identify what the jurisdiction's longer-term vision is for local opioid response and diverse funding streams. It's important to ensure that this planning is responsive to community perceptions as well of the issue, and what stakeholders, including people with lived and living experience, see as viable long-term solutions. And jurisdictions should ensure that processes are transparent and that decision-making opportunities are open to and also engage the public. So I know that was a quick rapid-fire overview of our principles. On the next slide, we'd like to propose and just, ask y'all, given what we've shared on this prevention continuum and on the framework for moving upstream, in what ways are you uplifting primary prevention strategies and the work that you're doing? And we welcome you to share this in the chat. All right, I see Kelly has shared communication campaign. That is incredibly important.
And I could really see the communications campaign being very connected to how jurisdictions are working to address positive social norms and stigma as well. Any other ways, don't be shy today, any other ways jurisdictions or of the work you're connected to that you all are thinking about primary prevention in the opioid space? Or any ways you think primary prevention strategies may need to be considered? Supporting academic detailing for providers. Absolutely, Julia. Thank you so much. Educating our community about substance use disorder basics. Yes, Charlotte, thank you. Elisa said psychoeducating our community. Overdose reversal education. We have one project that is a program, Caitlin. Please share more about your project or program and where it might be happening. Youth mentorship, absolutely. One of the things that's been coming up in our conversations, particularly with some of our partners in California, is the connections to tobacco settlement and how a lot of those funds were used around youth advocacy, youth mentorship, and youth leadership development. Maddie, help. I see lots coming in.
I know. I feel like you're doing an amazing job, Dana. I'm like, I don't need to step in here, but everyone is coming out in the chat now.
Yeah.
I love it.
They
We
needed a
got
second to think about it. I see a lot around addressing social determinants of health, and that's absolutely one of the opportunities we see, and that we heard from 20 plus communities that we worked with in Ohio over the course of a couple years to really think about primary prevention opportunities, creating safe spaces for you to build healthy peer-to-peer connections, very important.
Yeah, we got
They're
a few
coming.
folks who are working with youth, and I think that's definitely an upstream approach to be taking.
Dana, I in there about funding coordinators for coalitions. That's really important too.
Yes, funding and resourcing multi-sector coalitions. I saw a heart on that, I think. And we know that across jurisdictions, that there are a number of traditional and non-traditional partners coming together to think about opioid response. And there may be opportunities to resource coordinators that can really provide infrastructure for those coalitions and keep the work moving across partners. Marketing and PR, social media, news, articles, radio interviews, developing youth-led support groups in neighborhood settings. Again, a lot here around working with youth. And if I'm missing anything, Maddie, please jump in.
I'll just I don't know if this was covered yet, but where is it? Angela shared that, they're looking at the ecosystem of support for youth and families to promote well-being and considering where there are gaps to be filled. I think that one is an excellent idea. Identifying who's doing what where and what gaps need to be filled in is essential in getting the work done. So wanting to be mindful of our time as well and knowing that our friends at RTI have a lot to share. So please continue to feel free to share your responses in the chat. And I think I'm going to go ahead and move us over to RTI's presentation to give them some time.
Well, thank you very much, Maddie. Appreciate the introduction, and hello, everyone. My name is Dr. Derek Brown from RTI International, and we've been pleased to partner with Prevention Institute and all the other partner organizations represented here on this effort. During this portion of the webinar, we are going to share with you a few considerations for monitoring, evaluating, and tracking progress and outcomes of the opioid settlement funds. Next slide, please. This is our overview slide, which gives you an idea of what we'll cover today during our portion of the webinar. We'll start with a brief summary of the importance of monitoring and evaluation for assessing the impact of the use of opioid settlement funds. We'll then walk through some principles for conducting effective monitoring and evaluation. Then we'll touch on some relevant considerations for evaluation by those participating in the opioid settlement process at the state or intermediary levels, such as state advisory councils, as well as those at the community level, like county commissioners, city health department officials, and CBOs. We'll then wrap up with a quick summary of these considerations and leave you with some best practices for developing an evaluation of the impact of substance use reduction related activities funded through the opioid settlement. Next slide. I'd be remiss if I didn't acknowledge and introduce you to our wonderful team members, most of whom you will hear from later in this presentation. I'm very proud of this group of individuals and the excellence and scientific rigor they've brought to this project. I've had the opportunity to work with all of them in some capacity before, so I knew I had the right folks when I brought them on board for this effort. As the leader of this small but mighty crew, I'd like to extend a big thanks to each of them. Next slide. As we know, the opioid crisis that has unfolded over the past couple of decades has had a devastating impact and lasting effects on communities across the country. The distribution of abatement funds to states and communities began about 2 years ago, and they're meant to be used on a range of opioid remediation activities, including prevention, treatment, recovery, and/or harm reduction measures and services. Given the large amount of funding distributed and the number of activities those funds can be applied to, decision makers and those with oversight authority need to account for how those funds are used and whether they're being used effectively. Furthermore, those who develop or oversee programs, data collection activities, reporting, and community partnerships have an obligation to ensure the funds are being used wisely and toward outcomes that benefit the communities they serve. This presentation accompanies an evaluation resource guide that our team is currently working on. The guide is meant to be a quick reference to some of the guiding frameworks and principles for monitoring progress and evaluating efforts that target the reduction of substance use and its related problems. We know that for some organizations, evaluation can be rather daunting, but it can be worthwhile to partner with or consult an individual or organization that is expert in evaluation methods and processes. Fortunately, there are a few options for locating an evaluator. Several individuals provide independent consulting services in evaluation. Professional organizations like the American Evaluation Association maintain a list of current evaluators that can be searched by name, area of expertise, or state location if you're looking specifically for someone located in or who is familiar with your state. Many universities also have research and evaluation centers that are run by research faculty and employ other scientists, methodologists, and evaluation experts. There are also small and medium evaluation consulting firms that may have a particular niche within the evaluation space. And then there are larger, more robust research organizations like RTI that have a cadre of accomplished research professionals with expertise in substantive areas like community-based substance use prevention and mental health. Any of these types of organizations may have the ability to approach an evaluation through a local lens, depending on where the experts are situated, an organization's stated needs, and any information available to inform the evaluation. Next slide. So now we're going to talk about some of the principles and frameworks for effective monitoring and evaluation, but first let's define these terms. Next slide. According to the CDC's Office of Policy Performance and Evaluation, evaluation is a systematic method for collecting, analyzing, and using data to examine the effectiveness and efficiency of programs, and, as importantly, to contribute to continuous program improvement. It allows us to understand why a program may or may not be working, with the goal of improving a program, strategy, or activity. Though related, monitoring differs from evaluation in that monitoring is meant to be used to track implementation progress through periodic data collection with the goal of providing early indicators of progress or lack thereof. Next slide. As officials with RAND have stated, states and communities have one chance to get the allocation right and to avoid some of the missteps that substantially diminish the potential public health impact of the tobacco settlement. This is true because this is one of the largest, if not the largest, legal settlements our country has ever seen. So this is a huge opportunity to make some kind of course correction to save lives and mitigate some of the lifelong harms caused by substance misuse. Now, I don't know how many of you watched the popular show Last Week Tonight with John Oliver, but he made a similar point in one of his segments that aired last month, where he discussed the opioid settlement in depth. I think I'm going to skip this portion, unfortunately, because we are running behind, and I know that PI has another segment after this. But suffice it to say, as John Oliver and others have stated, the call here is really to avoid the same mistakes with the opioid settlement and to use the funds for more meaningful, sustainable activities that will actually help people and not be an embarrassment to those responsible for allocating the funds. This is why monitoring and evaluation are important. Next slide.
That's settlement.
So now I would like to turn it over to my colleague, Barrett Montgomery, to discuss a framework for evaluation and some relevant considerations. Barrett.
Thank you so much, Derek, for that great introduction. In this section of the presentation, I'm going to be presenting some key frameworks and concepts that we'll be returning to time and time again as we talk more about program evaluation and some guidance for that. The first of which is the CDC framework for program evaluation. This is really at the heart of a lot of our recommendations. The CDC framework for program evaluation presents a practical, systematic, and reproducible method for conducting high-quality program evaluation and for integrating evaluation throughout the public health system. It's really useful for all program stakeholders, so not just evaluation experts. This diagram here visualizes the framework, and it's designed to be circular and therefore an iterative process, but it's also very much meant to begin with that top point there is engaging stakeholders, and it follows through clockwise to ensure use and share lessons learned. The second element of the framework is a set of 30 standards for assessing the quality of evaluation activities that are organized into the 4 groups that you see there in the middle. And those are utility, feasibility, propriety, and accuracy. Explaining all of these concepts and going really in depth into the guide is beyond the scope of this presentation, but we wanted to make sure folks know that we'll be drawing on this document pretty heavily, and it is a fantastic resource. And we'll, of course, be including a link to it in our forthcoming evaluation guide. Next slide, please. So when it comes to what folks at different levels should consider when it comes to evaluating an initiative, we think these considerations really cut across all levels of the opioid settlement funding. We'll talk a lot more about monitoring or evaluation plans and their importance, the types of evaluation designs we think will be relevant at different levels for evaluating uses of these funds, how to think about different outcomes on the appropriate timescale so that we can appropriately plan and be realistic about them. And finally, the key practices of making data available to the public and soliciting feedback from participants and as well as providers. Next slide, please. Thank you. So monitoring and evaluation plans are your roadmap for success in an evaluation. We think the most important things to remember here and to implement are the SMART objectives that are really both heavily touted by both the CDC and SAMHSA. SMART stands for specific, measurable, achievable, relevant, and time-bound. It's considered a sort of a vague goal, like reducing overdose. How can you make it more specific? Who would do this? Where would it take place? Who is the focus population, and how will the goal be achieved? How can you make it more measurable? Make sure the outcome is something you can directly get data on. Overdose deaths or non-fatal overdoses work better than overdose, for example. As far as the achievable aspect, what's an ambitious but realistic reduction for reducing overdose deaths through a certain method? It's definitely something to consider for any evaluation plan. And finally, set a time bound on the goal using all of the specific context. So after applying SMART objectives, the goal of reducing overdose might become the county health department will decrease opioid overdose deaths by 25% among adults aged 18 to 35 in the county within 24 months through the implementation of a comprehensive naloxone distribution and training plan. It's a lot better. Next slide, please. Once the goal is set, what is the appropriate type of evaluation? There are many types of evaluation designs, and here we're going to focus on 4 that we think are the most useful in the context of the opioid settlement funds. Each type of evaluation really focuses on a specific type of outcome. First, outcome evaluations measure the changes that occur as a result of an initiative, typically in terms of the program's intended outcomes or goals. So in the world of public health, typically this is a health outcome, like fatal overdose, or an attitude towards a behavior that affects health, such as stigma of people who use drugs. An implementation evaluation is different in that it focuses on the actual operation and the delivery of the program rather than its outcomes. An implementation or a process evaluation is an assessment of how a program intervention, or policy is put into practice. These are often really important in understanding how a program typically studied in a randomized controlled setting best translates to the real world where you're trying to make an impact. Next slide, please. An economic evaluation is a systematic approach to analyzing the costs and consequences of alternative courses of action or interventions. In healthcare and public health, it's used to assess the value for money of different programs, treatments, or policies. These evaluations can be really critical in the context of the opioid settlement fundings because there are limited resources. And so folks are, of course, concerned that which of the interventions or which initiatives will produce the most change given these limited resources. And finally, we have policy evaluations with a bit of a question mark, which are typically evaluations of the outcomes of a policy or program. And I'm just using a question mark here because policy change is not a core abatement strategy as defined in the national settlement, but the funding of the abatement strategies at increased levels, one would hope would lead to policy changes once decision makers see what is working and what might not be. And you can think of policy evaluation as similar to an outcome evaluation done on a much bigger scale, in which we try to measure the intended effects of the policy and also consider what might be less favorable or unintended side effects of the policy. Next slide, thank you. When choosing an outcome and an evaluation design and writing your evaluation plan, it's really important to consider the expected time frame for change of that outcome. This is especially relevant when it comes to prevention. So setting realistic expectations based on the outcome of interest is really key. Some short-term outcomes that are achievable in short time frames and you can expect outcomes to change quickly include things like increasing awareness, distributing naloxone, immediate reductions in overdose rates based on the distributions. And some long-term outcomes that require more time or sustained effort include things like sustained changes in those attitudes and behaviors, addressing the systemic factors contributing to substance use disorders, many of which the type of things that Maddie referenced earlier. And also reduction in overdose rate can also be a longer-term goal depending on the approach. Just for an example, if everyone in a community suddenly had naloxone and knew how to use it, you might expect an immediate reduction in the fatal overdose rate in that community. On the other hand, a school-based drug use prevention program for fifth graders, those fifth graders won't mature into the typical drug using years for another 5 or 10 years. So you would not expect to see reductions in an overdose rate based on that program until that time hits. So the results might not be detectable until that time. A key takeaway here also is that systemic change and lasting reductions might take years to bring about, and we need a plan for that because these broader systemic changes have the greatest potential impact on public health. Next slide, please. Thank you. Finally, an evaluation plan should also include a plan for data availability and feedback. We believe that making data publicly available makes for a more informed public, which can also improve community feedback, leading to better adaptation strategies for your programs, ultimately improving the long-term sustainability, allowing you to do more good work, make more data publicly available, and so forth in this sort of a virtuous cycle. Making your results known can accomplish many things. It really builds trust with the community and stakeholders, informs the public and stakeholders as well as potential funders. It improves the quality of that feedback received, enabling evidence-based discussions and decision-making. And getting feedback from participants and providers is excellent because it's critical for program improvement and adaptations. So it shows what's working and what isn't, both for the provider level as well as for the participant. And it helps you to adapt the strategies to improve your real-world impacts and support continuous refinement of that approach, which is so important in this evolving overdose epidemic. Next slide, please. So I'm going to transition now to focusing on 2 different levels of the opioid settlement funding where monitoring and evaluation are especially relevant. Next slide, please. The first of which is the state-level advisory committees. Now, these committees can really vary a lot by state, but when we talk about state-level advisory committees, we're talking about the entities established in each state, which typically allocate the funds to local communities, support localities that are allocating funds themselves through a separate process. They often develop data collection processes to capture the impacts of the fund spending. And they also write the annual allocation reports for the government stakeholders and sometimes make those reports available for the general public as well. For example, in South Carolina, they call their board the South Carolina Opioid Recovery Funds Board. And in New York, it's the New York Opioid Settlement Fund Advisory Board. Each of them has a different name for each state, but that just gives you a flavor for what to look for if you're looking for the one in your state. My colleague Fikar Wandemaganyu is going to delve into how these frameworks for monitoring and evaluation can be applied to these committees. Take it away, Fikar.
Thank you, Barrett. So one key role that these advisory committees have in most states is identifying strategies and efforts to allocate the funds toward for the greatest positive impact in alleviating the effects of the opioid crisis in their communities. So to increase positive impact, it's essential that the programs, policies, and practices that are funded be evidence-based and backed by research. Depending on your goals, settings, population, and overall capacity, there is almost certainly a registry or a clearinghouse that can supply you with evidence-based interventions that could be your fit. So two popular ones in the prevention space are the United States Preventative Services Task Force and the Title IV-E Prevention Services Clearinghouse, which this screenshot shows a random page of. But as we can see at a high level, you can glance at the program name, what the evidence, when the evidence was last reviewed, the rating that it was given, and impact scores for subdomains. However, when you click on the program or the intervention that you're interested in, you'll be able to review more detailed information like the population that it targets and the certification and trainings required for implementation. And we recommend reviewing more than one clearinghouse or registry as they can provide varying levels of information. Next slide. So in many instances, these committees must also develop metrics to measure impact and ensure that the funds are being invested effectively. One tool for this is the Opioid Settlement Principles Resource and Indicators tool from Johns Hopkins University. It's OSPRI. And that helps you choose measures of impact based on the core abatement strategies in the national settlement, as well as common indicators. So states can pair these indicators that are also tied to key performance questions with actual strategies and interventions. So this helps to more effectively measure impact and allow for the realignment of funding allocations if needed. Tools like this can also be helpful for state entities in narrowing specific strategies that would be beneficial to their communities as well as establishing reporting systems. Next slide. So within each state's memorandum of agreement, a determination was made on how transparent they will be with the public about how settlement funds are allocated. Some states have agreed to be fully transparent. Others agreed to only disclose how county and local municipalities spend the funds, and a few states have decided to keep the information, their funding allocations completely internal. So what you're seeing is a map developed by the Opioid Settlement Tracker, and it illustrates the level of funding transparency across the nation. The colors are not that great, but we can see that the range of difference in transparency across the country. Next slide, please. So advisory boards can use opioid settlement funds to review historical data and make determinations on successful approaches based on the needs of communities. and the demonstrated impact of those previous approaches. However, as additional data is collected and needs are identified, those approaches should be reassessed. And in that process, using a framework can offer a comprehensive and standardized approach to understanding and addressing the substance misuse and related behavioral health problems facing states and communities. So for years, the prevention field has utilized SAMHSA's strategic prevention framework to measure success in the space. And the framework encourages starting with identifying the local needs through data collection, then building local resources and readiness, then finding out what works, what has evidence behind it, and how to apply it, and finally implementing and evaluating that process and its outcomes. So two cross-cutting principles, sustainability and cultural competence, should be centered and considered earlier on and integrated into each step. Next slide, please. So once goals are set and your strategies are selected, the implementation process should be monitored to find out if activities are being carried out as intended and within the set timeframes. So a logic model is commonly developed to illustrate and visualize these details. So we can quickly describe the boxes that you're seeing. So inputs can include funding, staff, partnerships, and resources, really whatever is brought to the table as assets. The activities might look like trainings, education, outreach, and treatment plans. Then those outputs tend to measure the reach of the activities through quantifying the numbers of staff that are trained or the number of individuals enrolled in a treatment service, and so on. The outcomes are what the activity is intended to accomplish, such as increased knowledge and awareness or improved access to treatment. And these are typically short-term and long-term. And finally, the impact can reflect a system-level shift that might sometimes take a bit longer to track and show. So I'll very quickly give a specific example. So if an input would be a partnership between local hospitals and community organizations, then we would list a full range of activities related to an integrated care program that combines medical treatment with support services. So that's our intervention. And an output would look like the number of individuals enrolled in the integrated care programs, or the number of people that have opted for a specific service, but also maybe something like the number of IT staff that are hired. Our outcome might look like an increased awareness of community resources and increased utilization of those resources and successful engagement of a specific community, like a tribal community. However, our metrics are defining engagement. And over time, we will hopefully see a strengthened relationships within networks of care. Now, say we had intended a certain number of people to be enrolled in our program, but that target was not reached. A logic model is a great way of going back to see if we can maybe change some activities or even the resources that are available to us. So the more detailed this is, the better. Next slide. Thank you. So evaluation and tracking is typically documented and summarized in reports. So these might be annual, biannual, quarterly, or monthly reports that summarize funding allocations and impact, which can then be submitted to the state's General Assembly or shared publicly to raise awareness. And this can use data to highlight results and outcomes, as well as community feedback to inform programmatic changes and the sustainability of desired impacts. And as we know, disseminating and sharing these findings can increase transparency, accountability, and continuous improvement. So this is where it might be useful to consider displaying your diverse metrics, also including testimonials from intervention recipients and data visualizations to make the information more salient and user-friendly. So to make the reports widely available and accessible, they can be displayed on agency websites and also shared via social media. Really thinking about ways to reach the target audience and even through your partners, local organizations, to disseminate to their networks via different avenues. And I think I will be passing it on to my colleague, Sazid Khan, for the next slide.
Thank you, Fika, much appreciated. Yeah, so, next up, we're going to be talking about some community level prevention and intervention efforts, monitoring, evaluation, as well as kind of go over a little more about the frameworks for the SPIF, and also kind of discuss kind of one of my favorite topics, and that's data. Yeah, so next slide, please. My colleagues have discussed, the SPIF framework as well as the SMART objectives, just a reminder of them and the importance of them at every level, as well as here when we're measuring impact for community level providers. These are key items to also consider and to go over. We'll go over a few more of these about the SPIF framework in a little bit, particularly cultural competence, sustainability, as well as different ways of measuring, implementing, and evaluating. Next slide, please. Yeah, sure. As I mentioned, cultural competency and ethics, sliding ethics in there. Cultural competency, as you saw, was kind of at the crux of the SPIF model, the SPIF framework. But first, I kind of want to chat a little about ethics first with you all, and ensuring that the interventions that you all are implementing and that those with the opioid settlement funds are implementing, that they follow the public health codes of ethics and principles is paramount. So it's necessary to ensure that we do no harm and that we do our best to work with respect to those who we are serving, and to ensure that we are being culturally competent, to ensure that our efforts are best aiding those who need it and in the settings that they are currently in. This quote from the CDC we found is pretty apropos for what we were kind of thinking here, that incorporating cultural competence in public health systems enables professionals to adapt their approaches to benefit individuals and groups from varying cultural backgrounds. Interventions are not one size fits all. They need to be adapted and tailored to who they are trying to serve. So being culturally competent and having ethics in mind when you are doing or implementing your interventions is key and paramount. Next slide, please. So when it comes to creating a monitoring and evaluation plan, some key items and key things to keep in it are data collection methods, which we'll go over in a little bit, analysis methods, a timeline, and something that is very underrated, and that's responsible parties. Who's in charge of what piece of this evaluation and of the monitoring? Defining, for example, data collection methods, who's going to be doing the quantitative analysis, the qualitative analysis, who's going to be doing it, who's going to be overseeing it, who has the authority to do what. So ensuring that you clearly define who the responsible parties are across the board at the beginning is very paramount to success. When it comes to intervention work as well as the evaluation work. And it's important to determine ahead of time what data you will use as you reference to establish benchmarks for comparison. So having a data collection plan, analysis plan at the very beginning of this, being able to map it out is going to be very key for the success of not just the intervention, but of the evaluation, ensuring you have quality data to evaluate, to assess how the intervention is going. We provide a link for a key resource for community level providers here, the toolbox from the University of Kansas. Next slide, please. So, like I said, one of my favorite things is talking about data and data methods. So there are many different types of data types out there. from quantitative data to qualitative data, such as surveys or questionnaires, right? You got collect standards information from many participants. You can measure prevalence, attitudes, knowledge, and behaviors. Attitudes, knowledge, and behaviors are some things I'll bring up again later on when we discuss outcome evaluation versus some of the other types of evaluations and different types of outcomes. Surveys and questions are pretty easy to administer and analyze, and it can reach a wide audience, such as this one. Interviews are a little more in-depth qualitative insights from the individuals. Here you can obtain more rich, detailed data that surveys might miss, being able to get more finite details out of it. That's a qualitative example. And it's here where you can understand personal experiences, motivations, and perspectives. Next slide, please. Getting even more specific, you got focus groups where you facilitate discussions amongst a group of participants to explore collective views, explore complex issues. This is where you can really, really dig into some topics and some really deep discussion here and really gain some insights from group dynamics and interactions. And then kind of, looking at secondary data sources, administrative data, which is using existing records. So like vital records, for example, mortality data is an example of administrative data from organizational databases, whether it be your local vital records or your state level vital records, or even at the federal level, such as the CDC. You analyze outcomes using historical and ongoing data, working efficiently and cost effectively, or you obtain objective evidence. So as the different types of data sources I've kind of mentioned, from focus groups to interviews to administrative data to surveys, they have different levels of lift required, resources, budgetary considerations. They have different levels, and kind of based on where you are budgetary wise and what your goal and objective is, different types of data sources and data types are best for your type of evaluation that you're looking for. Next slide. Thank you. So as I kind of mentioned, all the different types of data types, some are more useful for specific types of evaluations than others. For example, you've got, and we'll, on the following slides, we'll kind of, focus on specific parts of this. I know it's a little hard to read right now, so we have slides that kind of makes it a little bit easier to read, but we've got different types of evaluation. Again, this is kind of a general overview. There are, of course, exceptions and differences and tweaks and adaptations that can be done to these, but in general, you've got implementation, outcome or impact, you got cost or economic evaluations. And then, as you can see, there are different data types and measures of data underneath each. Again, generally speaking, again, there can be tweaks made and adaptations based on type of evaluation and the work you're trying to do, and some could be more applicable than others. But in general, these are kind of some of the different types of data based on the different types of evaluation. Next slide. Yep, absolutely. We love data here as well. Looking specifically at implementation data, so implementation evaluation, which assesses the effectiveness, efficacy, and process of intervention efforts. So things like facilitators of barriers to the implementation, right? Reach, how many people you're reaching, adoption, how many people are, really buying into the intervention and the process along the way. So you do that through different types. Again, this is in general, things such as surveys and focus groups, internal administrative data, surveys and focus groups if you're looking for adoption of the intervention, right? Again, different funding levels for different things of how in depth you're trying to get and what access you have to resources. And we'll kind of go over like which ones are more apropos for different levels of intervention next. Next slide, please. So outcome or impact. So these are potential outcomes you could see. Measuring in samples, measuring community sizes, with things such as survey focus groups, or you have external administrative data or surveys. Like I mentioned, the mortality data or hospitalization data are examples of administrative data. Things such as the BRFSS survey or the NISDA survey, which is National Survey on Drug Use and health, examples of external administrative data surveys. When you think of outcomes, there's a couple different ways of looking at it. You've got proximal outcomes, which are outcomes that you can realistically affect within start to see an effect within 6 months to a year. As I mentioned earlier, things like knowledge, perception of harm, attitudes, beliefs, things like that, you can start to see effects on through education and training. Then you've got the more distal outcomes, which are the more long-term, right? So looking at the negative impact of the opioid epidemic across the community, a state, across the country, right? Those are the more long-term goals, is reducing that negative impact. By making progress at the proximal outcome level, you can then hopefully start to see over time changes at the distal level, right? So changing people's attitudes, perception of harms, beliefs, knowledge base, right? You change that, you can then lead to changing the distal outcomes later on. And seeing success at the proximal outcome level helps to build buy-in from those who are funding it, right? To see, all right, you're starting to see some progress at the proximal outcome levels, which we then believe will lead to distal outcome as well. Next slide. And cost or economic, one more back, thank you very much. Yeah, so cost or economic evaluation, just 1/3, more and more being more and more valuable and more being necessary for a really rigorous evaluation, right? Including cost or economic evaluations. So cost and economic evaluations look at the financial impact, performance, and identify where costs can be optimized. So you could have cost benefit analyses, you could have startup costs, you can also have cost alone data, internal administrative data, external administrative data, and surveys are ways of also to gathering cost-specific data for economic evaluations. And again, it's becoming more and more pertinent if you're trying to do a truly rigorous evaluation. Next slide. So as I mentioned, to tailor the robustness of the evaluation to your resources and bandwidth, you must be efficient, work to produce information for sufficient value that the use of resources is justified. So based on the level of resources and bandwidth, again, this is a general table. This is, like I said, nothing's a one size fits all, but this is a good foundation and a way of starting to think about what type of data types would be useful for the type of evaluation you're capable of at your budget and resource level. So if you're a small community in terms of resources and bandwidth, things like gathering external administrative data or collecting small quantitative surveys to do outcomes and impact evaluation might be what's most necessary. Whereas medium to larger community, or even at the county level, you could do, again, everything that was done at the small community level, plus administrative data, internal administrative data, and focus groups to look at outcomes and impact evaluation, as well as potentially start to get into implementation or the process evaluation, seeing how it's being done, right? Having the resources to be able to evaluate how the interventions are being rolled out. Then at the state or possibly at a large county level or something like a New York City where they've got different boroughs at the large population, right? Where you could do the first two levels plus internal and external cost data, right? This is where we're expecting more at the state level to do the rigorous evaluation where it involves cost and economic evaluation. So added in addition to the outcome impact and implementation. So again, this is a good starting place to see what would kind of align with the resources and funding that you have available at the level that you are at. Next slide, please. So some adjacent, but also still very important features to discuss. A speaker kind of discussed earlier about dissemination, right? This is also key for community-based organizations. Why? Because to build a strong reputation for the organization, for the work that's being done, show the value of community initiatives to stakeholders. And as I mentioned, that sustainability was kind of the crux for the SPIF framework. attract new funding, which can then lead to long-term sustainability. You got different tools such as visuals, stories, language that resonate locally, have a personal tone, strength-based, and positive impact, right? Not just talking about what the negatives are or like things that need to be improved, but also talk about the bright spots as well and show like, where it is that improvement has been made and the progress that's being made as well. And for dissemination, how is your target audience most likely to be reached, right? Or will they be reached via social media? Or if it's, lawmakers you're trying to target, is it through things like talking points? Is it through blog posts? Potentially more and more in this stage, you're starting to see at the state and federal level podcasts being utilized more and more. So identifying the correct dissemination vehicle for the audience you're trying to reach is also an important thing to identify early on. Next slide. And before I turn it over to Derek, we just wanted to discuss sustainability and continuous improvement. So regularly gathering feedback from program participants and providers, which helps, and this is the key, not just gathering the feedback from participants, but actually being able to incorporate the feedback is key to continuously improving the intervention efforts you are seeking to implement in your community, your state, or across the country, right? So actually being able to incorporate the feedback and having the bandwidth to do so is key. It considers the cost and benefits of the adaptation, right? So making sure that what the feedback is something that you're actually able to actually implement or adapt moving forward. And then begin, and we cannot stress it far enough, begin planning early for long-term sustainability, right? For those who have been on project work that has like 3-4 years of funding and then runs out, you build great momentum, have positive outcomes and positive impact over that period of time, but then you no longer have funding, right? And then the momentum stops. So, keep from that happening, being able to plan for long-term sustainability, either as some states have done for states that we have evaluated for other projects, they've had their providers and some grantees develop sustainability plans, actually document at least a framework for it early on, which even if it's not fully completed, they're at least starting to think about it, how to sustain the work that they're doing. It can be either done formally or informally, just to get the conversations going and kind of do a little bit of a scan over their community or of other potential funders. As we mentioned, for dissemination, right? If potential funders see, either at the state level through graded funding or other nonprofits or foundations, see the work that you're doing, and they may be interested in funding potential future work. So, while sustainability, in most cases is not part of an evaluation. Evaluation is important and prudent and a key to sustainability, right? So being able to evaluate and continuously improving the work you're doing can then lead to success, and that could lead to potential partners wanting to sustain the work you are doing moving forward. And that's why sustainability is something that we did want to harp on as a part of this webinar. And with that, I believe I will be turning it back over to Derek to kind of close us out.
All right, thank you very much, Sazid. So hopefully throughout this presentation, we've provided you with a broad base of considerations for planning, monitoring, and evaluation activities to support the use of opioid settlement funds in your communities and to ensure you're being good stewards of those funds. Next slide. This is a summary of the best practices that we've found necessary for demonstrating effectiveness and impact. Starting with developing clear, specific objectives will set the foundation for the strategic decisions you make in assessing needs, selecting activities, generating findings and results from your programmatic or intervention activities, and reporting to decision makers and the public. You want to set reasonable timelines and establish replicable protocols for data acquisition and analysis. Next slide. It's also important to understand what resources you have at your disposal, including the financial resources. because this can determine the breadth and detail that you use to structure your evaluation, and even determine which types of evaluation you conduct, as was described earlier in this presentation. The importance of representation and bringing community voices to the table cannot be overstated. Not only will they help guide you and help you recognize any tweaks that need to be made along the way, they are some of the most critical folks from whom you want to gain buy-in and establish ownership that will support the sustainability of your public health response efforts. Next slide. So that brings us to the end of our presentation. I want to thank everyone for your attentiveness. And now I will turn it back over to the PI team. Thank you.
I was muted. Thank you, Derek, and thank you to the RTI team for sharing their insights on monitoring and evaluation. Hopefully, you all found that as useful as we did. Their content, as Derek mentioned, will also be documented in a report that will be included on a new resource hub site that we are pulling together. Now, we're excited to preview that site for you today as we prepare to share a public link with you all following this webinar. So if you will just give me 1 second as I pull that up for you all. Now, this set of online resources, which includes guidance documents that are authored by Prevention Institute, by our project partners and external experts, is intended to offer guidance as you continue to consider policies and programming to establish using opioid settlement dollars. Now, these resources are not meant to be comprehensive, but rather a starting point really for continued research, conversation, and planning. So after you peruse some introductory text that offers additional context and background on the issue and the project, you'll land on the 2 primary sections of the site. The first is featured resources. Now here you'll find resources that are authored by us and our project partners, as well as comprehensive and foundational trackers and documents that we feel encompass multiple aspects of the opioid settlement process. So these resources really are a great starting point for your research. The other section that we've included on this site, and that's much more comprehensive, is resources learning to action. Here you'll find resources across a continuum of navigating opioid settlement dollars. So as you'll see, we've organized resources here into 4 subsections. The first is planning guidance, which contains principles, frameworks, and example abatement strategies for consideration in your jurisdiction's response planning. The second is implementation models, where we have example policies and programming that are currently being implemented across the country, best practices that you can pull from in your own programming and design. Evaluation and sustainability, which really is a continued conversation from the helpful information RTI shared here. So you'll find here additional resources on monitoring and evaluation, including the Johns Hopkins OSPRI resource that Fikar mentioned during the presentation. Lastly, and perhaps most self-explanatory, background information. Here we have additional context and history on the settlements and how funding mechanisms work in case that information is of use to you all. Now, each digital resource includes source information, thematic tags, suggested audiences, and a brief description to help you in choosing the resources that are most appropriate for your thinking. We are very appreciative of the support provided by Big Cities Health Coalition in not only building, but of course, hosting this website out. And we hope that this set of resources will really help to fill in any information gaps that your jurisdiction might have as you consider how to receive, plan for, and execute opioid settlement dollars. So that was a very brief preview. We are excited, of course, to soon pass this along to you all for continued exploration and use. But with that, that really is the end of our webinar for today. But of course, before we let you all go, we would very much appreciate your feedback through a short 6-question poll. All responses are, of course, optional, but are greatly appreciated as we continue to shape our understanding of the value of this webinar and the content we shared. So please take a moment, if you have it, to add any thoughts you have to the poll that has just launched on your Zoom screen. And as you do so, I'll offer a few closing notes to share for you all. As a reminder, keep an eye out in your email inboxes for the official public link to our Resource Hub site. Again, we're excited to have you all explore that very soon. We will also be posting a recording of this webinar on our project site. You can find recordings of the full 3-part webinar series on that site in case you'd like to revisit prior learnings. Thank you again to the CDC's Division of Overdose Prevention for their support and guidance, and to our guest panelists and project partners at Big Cities Health Coalition, Drexel University, SheRay and Associates, and of course RTI for sharing their expertise throughout this webinar series. Again, we hope this was as helpful to you all as it has been to us in figuring out the best ways of integrating primary prevention into the response to the opioid epidemic. So many thanks to you all as well for your time and participation today. You're, of course, are free to reach out to our team at Prevention Institute with any questions and or feedback that you might have. The communication channel is very much always open. So again, if you have a few minutes to spare, please respond to the poll that's launched on your screen, and we'll stay on for a few more minutes to give you that time and to answer any questions that you might have. Thank you all very much.